Hi everyone, thanks for joining us today, having your lunch with us on our Lunch and Learn session. So this one's a session on electronic prescriptions and e-pathology. I'd like to start by acknowledging the Aboriginal and Torres Strait Islander peoples of this nation. We acknowledge the traditional custodians and sovereign people of the land across which we work. We recognise their continuing connection to land, water and community, and pay respect to elders past, present and emerging. So very quickly to start, there's a little bit of housekeeping. We are recording this session today, so that will be available on our YouTube channel in a few days after this is finalised, the presentation. There will of course be evaluation as well. That will come up in the chat towards the end of the presentation, but if you happen to miss that or log off a little early, you will also get an email to request that we get that evaluation filled in, and please do fill it in. We really appreciate your feedback and it helps us better plan future presentations, including time. And I think some of you might have been on the last one last week, and we have taken on board the time. We just couldn't change this one, but we might change it a bit in future. So I'm Nerida. A lot of you have already met me before. I'm Nerida Croker. I'm one of the digital health officers here at CESPHN, and I'm joined today by Linda Silva, who's another digital health and QI program officer. As we've said before, there's lots of us. So we're going to talk about electronic prescribing and e-pathology. So what we're going to talk about today is mostly geared towards general practice, but of course there's other people involved certainly in electronic prescribing. There's a lot of pharmacies involved, and if anyone has any other questions around other practices or any other ways to access this, please do contact us or ask us in the chat today. And that's what I should have said. We're happy to take questions. We'll answer them towards the end. You can put them either into your Q&A box in the little Zoom panel, or you can put it into chat box, whatever you prefer, and we'll answer them. If we happen to get a lot of questions and we can't get through to all of them, we'll certainly answer them and send them out with the evaluation. So before we just talk about the electronic prescribing, I put up a slide about some other bits and pieces, and actually I'm going to turn our camera off, but you'll see our slides. Hopefully you'll continue to see that. So so we don't only do, of course, electronic prescribing. We can do all sorts of things. We can help you with any of the access to HR service, so your HPIO, your HPII, all the acronyms, your security certificates, your NASH and your PKI. We can help with telehealth as well, particularly with the Health Direct video call platform. We can set you up with that, or we can give some training on that if necessary. But anything you need help with, just contact us at digitalhealth@cesphn.com.au. For e-prescribing, there's a dedicated email address, so that's eprescribing@cesphn.com.au. And if you happen to know the name of your digital health officer that looks after your practice, you're also more than welcome to contact them directly. Okay, so most of you would know that electronic prescribing exists. It's already here. The idea behind it is around, you don't have to have that paper prescription. Instead of having the legal valid prescription only being that piece of paper that the doctor has signed, there's now capability for an entirely electronic script to be sent via the prescription delivery service directly to the patient, and then the patient can present that to any pharmacy which is registered for electronic prescribing. The pharmacy scans that token, which comes as a QR code. The pharmacy can scan that, open it up, and that's where all the details of the prescription will be unlocked, as it were. The pharmacy then dispense it as they would normally dispense a prescription. But if there's a repeat, again, there's no paper involved. Instead of having a paper copy given back to the patient or maybe kept in the pharmacy, the pharmacy software actually makes a new token, and that's sent back to the patient directly. So they have a new token as their repeat prescription. There's a few things to remember, I guess, around that though. So that's very basic. I have obviously gone through that quite quickly. We only have a relatively short session, so we're not going to go in all the details of exactly electronic prescribing and the tokens, but it's very, very useful for some people. We do need to remember that this is not necessarily going to be for everyone. There's always going to be the option of a paper prescription for your patients, as some people just don't want these, or maybe they don't have access to technology. So they might not be able to get a text or an email. If you really had to, you can print out the QR code onto a piece of paper. That is possible, but to me that sort of negates the having no paper thing. So you know, if you're going to print it, perhaps you just print a paper prescription, but that is a possibility. But there'll be lots of people this is very, very useful for, though. So anyone who has a telehealth appointment to start with, you can directly send them their token. You don't have to be worrying about your practice staff having to, you know, print pieces. You know, you're printing out the script and you're signing it as a GP, and then the practice staff have to print it or scan it and email it, or find the details of the pharmacy to email it, or maybe put it in the post to the pharmacy, or post it to the patient, or the patient comes pick it up, or whatever way you might have been doing it. This means that you don't have to do any of that. You can send that actual valid legal prescription token straight to the patient, or if they particularly request, you can send it directly to their carer or even directly to their pharmacy, as long as that's a patient request that comes from. So yeah, again, that's really handy for people who might need a carer to pick up a prescription for them, or even, you know, the patient has their token on their phone, they can actually forward it to someone else as well. You know, if I get stuck with my day at work, I can send it to my husband. Can you pick that up on the way home? And again, there's no paper to be sending through. So some really good reasons that you might use electronic prescriptions. And the other one, of course, is that it is, in a lot of ways, it's a lot easier for the GP, particularly around S8 prescriptions, but I'm going to get into that a bit later on. So as I said, I can't go through every single requirement probably in full depth, or this would take a very long time, but these are the general requirements for having electronic prescribing set up in your practice. So the HPIO, that stands for Healthcare Provider Identifier Organisation. That means your organisation or your practice is registered for the HI service. If you're using My Health Record, or if you have ever been signed up for My Health Record, you would already have an HPIO for your organisation. Then you need the individual identifier, the HPII, Healthcare Provider Identifier Individual. Each registered prescriber, so anyone who has an ARPA registration of any type, so not just general practitioners, but pharmacists and nurses and physiotherapists, and anyone who has ARPA registration has already got an HPII. They may not know it, but they do have one. It's not your it's not your registration number, but it is linked to your registration. So if the individual practitioners need to find that number out, they can call up ARPA and find it, or they can call the HI service and identify themselves and get told their HPII. So you need that for the software to be able to issue electronic prescriptions. And the other identifier is for the patient. So again, it's linked to Medicare, but it is not the Medicare number. But that generally means you need to have the patient details in your system with name, gender, date of birth, and a Medicare or a DVA number. And that IHI can be validated through the software. Updated software is very, very important. Please make sure that you always have your software updated, because there's lots of new I guess, you know, new drugs are coming through, new PBS requirements, and all the different things. So you need to make sure everything's always updated. And of course, the actual system requirements can do this legally, talk to the systems and talk to the prescription delivery service and get all the information across. So that's the other thing you need, a connection to one of the two prescription delivery services. There is either ERX or MediSecure. At present, MediSecure is not yet working with our systems that we predominantly have here in our practices in CESPHN. So best practice, it is coming. It's coming with the Service Pack 1 for CESPHN. Is that what it's called? Best practice CESPHN, but we don't know an exact date of when that will be released, but it should be soon. We were initially told it would be in April, so obviously we're in May. So we're expecting that sort of any day, and then MediSecure and best practice will work together. Medical director, we can't give you a date on that at present. So again, we expect it will come, but right now medical director and MediSecure don't talk to each other in the way they need to do these electronic token prescriptions. You'll also need some of your security certificates, your PKI certificate. And the other thing that you need to think about is the patient contact details. So given that these will be sent either via an email or via a text, we need to make sure that those contact details are up to date. And it is the general practitioner's responsibility to make sure that they're sending that prescription to the correct details. So, I mean, certainly you can ask the practice staff to update it, but ultimately when you're issuing that prescription, you should be checking that the patient receives it. And that is another thing that we recommend if you're having a consultation and you're issuing an electronic prescription token, that you just ask the patient then and there, have you got it? Most people will have their phone on them. Hopefully they may have their email availability. And so it's ideal if you can check that they did receive it. It saves a lot of hassle for later on if it's accidentally gone to an old phone number or misspelt the email or something like that. But if it does happen, we can still fix it, and we'll talk about that too. So a lot of people are a bit concerned about the security of electronic prescriptions, and it is very secure. And I guess there's a lot of safeguards built in. One of them in particular, and again, when we talk about S8 prescriptions, I guess this is what maybe people immediately think of. It is not possible to have tokens dispensed more than once. Even if I was to receive a token for an S8 prescription and I forwarded it to 10 of my friends and said, okay, everyone go to a different pharmacy at 2 o'clock today and we'll all get our S8. It will only work for the very first person to scan the prescription token. So, you know, even if everybody does as close to 2 o'clock as they can, whichever one gets in first, that's the one that's going to open up. That pharmacy will be able to dispense that token if they believe it to be legitimate and so on, but every other token will show as already dispensed. If, for example, that, you know, if it wasn't that somebody was trying to do something wrong, if it was a person went to a pharmacy, the pharmacy scanned it and then said, oh, actually, sorry, I just realized we don't have this, we're totally out of stock, we can't get it, then all that happens is the pharmacy cancels the prescription and that token is reactivated, and so then the patient can use it at a different place. They don't have to have a new doctor's appointment to get a new token or something like that, but it is very secure. As I've already said, it's all sent by the prescription delivery service. And the other thing to keep in mind is the legislation. So up until, I'm not sure exactly, but mid last year certainly, the legislation absolutely said you had to have a paper prescription because it had to be a signed, like hand-signed prescription. That has been updated in New South Wales. It is legal to have an electronic token prescription, even for S8s, and they've actually changed some of the legislation around S8s for electronic prescriptions to allow that you don't have to have handwritten words and figures. You know, some of those rules around paper prescriptions for S8s, they don't apply to electronic prescriptions. So that's why a lot of our doctors like it, I think. There's less sort of handwriting, less rewriting out name of the drug, strength of the drug, all of the quantities and all of that. So there's no requirement to do that for an electronic prescription, but you will need to enter your password in twice to make sure that you are sure that you want to issue that S8 prescription. So I guess that's one of the things to keep in mind around the legislation. Please note though, that if you're running a paper S8 prescription, all that legislation stays the same as it was before. So you still have to handwrite everything on a paper prescription. I've got a little video, let's hope it works. This is just a very brief video about how best practice electronic prescribing works. Okay, so that was for the best practice software. So a few things that you did see there. So on that screen that's there at the end, you can see whether the prescription was sent as an e-script or, well, basically if it was an e-script or not, but that might help tracking if you're not sure if you did a paper script or an authority or something like that, or if you did send it as an e-script. You probably saw that it's quite simple to resend. So if the patient said, oh, that didn't come through, or probably more likely what they might say is, oh, I'm really sorry, doctor, I accidentally deleted the text or I accidentally deleted the email. It is quite simple to resend. Now, again, with the security, even if someone told you that and that wasn't true, that they had actually had it dispensed, if you resend the token, that's not a new script, it's the same script. So they can't reuse that token if they've already used it. It will just come up on their phone and say, this is, I think it says this has been dispensed or something like that. But it certainly won't allow someone to keep ringing up and say, oh, I deleted it again, whoops, oh, I deleted it again or something, and keep getting issued the same prescription. There's no way that that can happen. If you were to cancel the prescription, if they've already had it dispensed, you can't cancel that supply. So if they've already had it, even if you were to cancel the script, they've already got it. But if there was repeats, it would cancel the repeats. So again, even if they had the repeat token on their phone and then you've cancelled it in the surgery for some reason, maybe they need to go to a different strength, they've changed their medication, so you want to make sure they don't get confused. So you cancel the old prescription, then that will mean that even if they have that token and they try to take that to the pharmacy, it'll actually say prescription cancelled, and it won't be able to be issued. And then obviously the patient will either go, oh yes, that's right, I have a different one now, or they'll contact you or whatever. So there's some quite good safeguards built into that as well. I don't have a video for medical director, but in a lot of ways it's quite similar. So with best practice, you saw that really the writing of prescriptions was the same as you normally would do. It's the only difference is the printing. Instead of printing it onto your printer and signing it, you send it as a token. So again, medical director is quite similar. On this slide here, these pictures you can see on the left-hand side there, deliver prescription token by, you can choose by whichever, SMS, email, paper token, like I said, you can print it. And the right-hand side of the screen, or certainly the right-hand side for me, is just sort of some of the things you need enabled. So I've just marked there that's where you need to have your organisation, your individual HPI. So your individual HPII needs to be in there. Each doctor that wants to be issuing tokens must have this set up so they can have, that it needs to be enabled in there. And then it will hopefully all work nice and easily and be quite a simple process. And so, as I said, the workflow, as far as I'm aware, I'm not a general practitioner, but as far as I'm aware, it's very similar workflow. There's not a lot of difference to how they would normally be working. It just is a slightly different way to actually send the prescription to the patient. And also on the best practice video, you might have seen that password comes up again. So again, like I said, that's particularly with S8 prescriptions, that's a security requirement, that the prescriber enters their password a second time. So please, again, remember for everyone, it's always important to keep your password secure, but definitely if your GPs are issuing electronic prescriptions, it's very important that they do have their password secure, that they don't share that no one else knows it. And the reason being, obviously, you don't want to have a situation where somebody issues an S8 prescription to a patient using a doctor's login and their password, and then, and that's maybe not, if it was a staff member or something else, or if it was, I don't know, up on the wall and a patient went past and managed to do it for themselves, we don't want that situation to occur. So it's quite important that the passwords for the practitioners are kept secure. So for the end of the electronic prescription part, there's a few things that we talk about a bit, I guess, that we get asked a lot. I've already talked a lot about S8, so I probably won't talk about it too much more, but it definitely is legal. It's all valid. If your pharmacy has any particular concerns, you're more than welcome to refer them to me, because I deal with all the pharmacies, or digital health here generally, and we can send them the necessary legislation from New South Wales Health, but hopefully you won't find that. I think initially a few pharmacies were a little bit reluctant. They were a bit nervous about doing token prescriptions. It's a different way. They're not used to that way. So there was a little bit of concern. And sometimes doctors were saying that the pharmacy was saying, oh no, you have to give me a paper script as well. But that's definitely not true. And if you did do that, it's like you wrote 2 prescriptions for the S8. So you don't want to do that. So yeah, the token is fine. Resending and cancelling prescriptions, again, we've already sort of talked about, but it's certainly able to be done. The active script list is something I haven't spoken about. That is the next stage, and that is coming soon. It's just been rolled out in Tasmania, and I think also in Victoria. It's not here in New South Wales yet, but the active script list is the kind of follow-on, and it means that, as it sounds, everything that is an active script for a patient will be kept in the cloud, in the prescription delivery service. The patient has to sign up for this. They have to say, yes, I want an active script list, and they're going to do that through pharmacy. The pharmacies will be involved in signing up patients and getting all their details. They'll have to validate their identification and so on. Then once the patient has an active script list, anything you prescribe for them will go automatically onto that active script list, unless they specifically say, please don't put that one on there, doctor, I don't want that one on there. But otherwise it will basically happen automatically. And it just means that you don't have to have the token. They'll be able to go to the pharmacy. They won't need any paper. They won't need anything. They won't need paper or tokens. They will go into the pharmacy. They will say, hello, I'm Nerida. I would like to get one of my prescriptions, please. If the pharmacy already knows them, and if they probably signed up in that pharmacy, it'll be very, very easy system to do if they've already given their authority to the pharmacy to access the active script list. If it was a new pharmacy that they've never been in before, they will need to identify themselves. More than likely, they'll need to provide photo ID at least the first time. And then the pharmacy will access the active script list. But before they can do that, the patient will receive like I believe it's going to come through SMS. It will be a consent message, and it will say, the Central Eastern Sydney Pharmacy are trying to access your active script list. Do you grant access all the time? Press 1. Just today, press 2. No, I don't grant access, press 3. So the patient will then have the option to allow the pharmacy to look at their active script list at all times, or maybe just for the day if it happens to be somewhere they're traveling through, or a pharmacy they just popped into because they desperately needed something. And obviously if you got a text like that and you weren't in the pharmacy and you're like, why are they trying to access my script list? You just would say no. So that will be the security aspects of it. But again, it will save a lot of time and effort for everybody, particularly for patients who have a lot of medications, or maybe if you have patients that have their medications packed into a blister pack by the pharmacy, there won't need to be sort of back and forth about we need scripts for this and that. It'll be there in the active script list and they'll be able to access it. So that will be, I guess, another development that will be another improvement in the system. The tokens will also still remain. There will still be the opportunity to just have a token, and anybody who maybe only gets one script every, blue moon will maybe just say, no, just a token's fine. I'll stay on that. Thank you. The costs of this program is another thing we frequently get asked. So right now, the government is funding the costs of SMS tokens being sent, and that is currently being extended until the end of June 2021. They have extended that a couple of times. After that, we can't say. I don't know. I have no information about what will continue with it. the idea, I believe, is that once active script list is running, that the government will not fund it, but that's not anything I've heard officially. That's certainly what I believe is the situation. But until June, at least, they're paying. If they, at some point in the future, do not pay the costs, the practice that issues the token will be having to pay if they SMS it. At the moment, it's around about 3 or 4 cents per SMS, and that will depend on your system. With BP, you might need to sign, well, you do need to sign up for BP Comms, I believe. But the other thing to keep in mind is that usually sending an email token is no cost at all. So, and I assume that will remain the same. So at all times, there should be a way to do it without any cost. And if the patient particularly wishes for SMS, then yes, you may, in the future, you may be required to pay a small cost. And like I said, that will be whoever issues the token. So if the general practice does the first token and then the pharmacy does the repeat, the pharmacy pays for the second repeat. So you only would ever be paying for that first time that you SMS'd it to the patient. You don't pay for any future SMSs that they get that are tokens. I guess unless you reissue it if they lose it or something like that. There's a couple of apps that the patients can use for managing their scripts, which are quite handy to know about. MedAdvisor is one. My Pharmacy Link, I think, is the other one. There's probably others as well. Some of the bigger pharmacy chains do have some of their own apps, like I think Priceline has one, and maybe Chemist Warehouse. So they're quite useful because the tokens can be stored in the apps, and then often they can be sent directly back out to the pharmacy as well to get ordered. And it does help with, not losing the email or not accidentally deleting the SMS or something with the token in it. They can keep all of that. And also, of course, the patient then has an idea of, oh, yep, I've still got that script. I've got 2 on that. I've got 3 on that, or whatever. Troubleshooting, just one of the things that Linda particularly she does a lot of this with our GPs, has mentioned is you do need to make sure that you've validated the IHI for the patient. So if some reason it's not working, that might be one of the issues that you come across. There's obviously a few different ones. And again, we're always happy to help people out if we can. And sometimes we can't. We might say, no, that's got to go back to best practice, or it's got to go back to, one of the other software people to work that one out, but we're certainly happy to help out. So I think that covers most of the electronic prescription part, and certainly, like I said, we will have questions towards the end if you have any questions. So now what I'll do is I'll hand over to Linda, and she will continue with our e-pathology part of the day.
Thank you, Nerida. Hi, everyone. My name is Linda Silver. I'm a Digital Health Officer here at CESPHN, and I'll introduce e-pathology, which is another digital initiative we support GPs with. So e-pathology is a process where a GP issues an electronic request to the pathology provider, which is generated from the clinical system, which in turn allows the pathology provider to upload a copy of the results to the patient's My Health record. This supports clinical information sharing among providers, and also helps to meet the huge demand for pathology results we see when healthcare providers and consumers interact with the My Health record. There are a couple of private providers in our region who can configure your software to be able to send electronic requests directly to their database. And there's only a few requirements which you have to meet. One of them would be to run a newer version of the medical director or best practice software, and also to have your PKI certificate configured and imported into the software, because e-orders also use the patient IHI to identify them. And of course, it's necessary for the patient to be registered with the My Health record to get a benefit from it. And also, it's also good if the practice has direct access to My Health record through their system. In order to send an electronic request, the workflow doesn't change for the clinician. As you can see, the request form, this is an example with medical director. The request screen only changes slightly. Instead of a print button, you have a print/send button. This is because the patient can still receive the printed request form on a piece of paper like they are used to, and the electronic request is automatically dispatched in the background to the pathology provider. The same would be for the best practice software. Again, the only change is to see print and send button. Once you are configured, nothing else changes. So here would be an example of what the patient would get in their hands. So once you are configured for e-orders, you will see a barcode on the printed form, but that's the only change that would happen. And as I said before, the printed form is not even necessary. Let's say during a telehealth consultation, you wouldn't have a chance to hand it over to them. So this is a ePathology workflow at a glance. So as I said, the referring GP will dispatch an electronic request alongside a printed copy to the pathology lab. The lab in return would send back the results to the GP the usual way, but at the same time, they would upload a copy of the results to the patient's MyHealth record. The copy that sits in the MyHealth record would be available to the clinician and all other clinicians involved in the patient's care through MyHealth record immediately, such as their specialist, pediatrician, surgeon, endocrinologist could access it immediately when it's uploaded. However, the consumer would be locked out of that report for the first 7 days, to allow the clinician to recall the patient and consult results with them if necessary. The only exception would be the COVID-19 test results, which after upload, they are available to the patient after 24 hours. And so the benefits, as I said, there are benefits during a telehealth consultation because the patient doesn't need a printed request. They can just turn up at their nearest collection center and they'll be able to be looked up from the database. This also provides a better experience for the patient at the collection center because they are identified faster and processed faster, and also the results are available faster due to the reduced data entry and admin work. It also reduces errors with tests that have been requested or patient being incorrectly identified. And for the practice and a clinician, the benefit would be that there is no change in the existing workflow. It's business as usual, and everything electronic happens in the background. In terms of the information being in MyHealth record, it helps with information sharing, so every clinician can access the same information at the same time and provide a team care arrangement. It also helps when a practice can check through MyHealth record if they need to actually order certain tests and if you are not duplicating results, which saves them time and money. And consumers benefit from the upload if they are tracking and monitoring their chronic conditions, and also they do not have to call the practice to request a copy of the results. Another benefit is that this process is entirely flexible because the doctor and the patient have a control along the way what gets uploaded, and also if certain things can be opted out, if it's deemed sensitive, or they simply do not wish to have the record in the portal. And also if certain things end up in the MyHealth record, the patient has many options how to either limit access to certain clinicians or remove the document altogether, or just put a PIN code and completely control it. So it's very simple. You call your preferred pathology provider and tell them you would like to be part of the e-ordering process. They'll send you a form to fill out, and they'll arrange a convenient time for installation and testing. And on the day, you will just have to give them access to your server for a quick 10-minute configuration.
Thank you. So thank you to Linda for her explanation of ePathology. This is not really part of the presentation, but I'm also a pharmacist who does medication reviews, and I can tell you that if the pathology is uploaded to my health record for the patient, certainly it would help me with my medication reviews, and I would stop having to ring practices and taking up their time to ask them to please fax me the pathology that they had and that they forgot to put in the referral. So, you know, there's a lot of benefits, I think, from sharing that information between a treating, you know, between the team that's looking after the patient. So we have had a couple of questions. So one of the first questions that we've had is about dispensing what used to be called Regulation 24, now called Regulation 49 prescriptions, where the doctor prescribes basically a 6-month supply for a patient. And could that be done as an electronic prescription? And the answer, as far as I'm aware, is yes, it can be. There's no reason, as far as I'm aware, there's no type of prescription that you cannot do as an electronic token. So there should be no reason that you can't do that Regulation 24 or 49 script. The one thing maybe to keep in mind at the moment is it's not quite as bad now, but certainly last year at the beginning of COVID, and there was like a rush on medications, there has been some recommendations from the Pharmacy Guild and from the TGA as well, that pharmacists do not provide large quantities of medications to patients. But that's not around the legality of the script. That's just about, you know, trying to not have shortages of medications. But yeah, certainly as far as I'm aware, you can do your prescription as you normally would, and that should be totally fine for the pharmacy to dispense and give the full supply, whether that's 6 months or 3 months or whatever. Now, the other question, I'm going to ask it to Linda, and I'm not sure, but anyway, we'll find out. So around ePathology for GPs who self-collect blood specimens. So if you're getting your own, you know, you're doing the drawing of blood there. Do you know that answer?
Nerida, I will have to take this question back to the pathology providers because no, this hasn't come up with the workflow, but we can definitely find out and get back to you.
So thank you. We will take that one on note. Thank you everyone for participating. We really appreciate you taking the time. And please, as we said earlier, if you could fill out that evaluation, we would appreciate that. If there is anything you think you'd like to know more about, or anything we've talked about today, or even just if you want to know, I don't know, more about how to install electronic prescriptions or something like that, you can put that in the evaluation and we can send out information. Or of course, also, as I already said, you're always welcome to email us directly, digitalhealth@cesphen.com.au, and that will be triaged to the correct person and we can assist you with any of the matters that you need. So thank you again for attending, and we will see you at our next luncheon.